My name's Scott Dickenson. I'm a physical therapist and inventor of the Neckslevel Device. Here with me today I have Brian, who's going to be walking through each of the exercises with us. Brian is not familiar with the exercises, and so we'll be troubleshooting along the way with him. The first thing to see is rotation range of motion. So Brian, you're going to start by turning your head left and right. We want to see the platform sliding back and forth as he's doing this. This is the bread and butter exercise for the Neckslevel Device, and I believe all patients should use this to get familiarized. He's doing a great job of maintaining pure rotation, and he's not side bending. I'll often cue the patients for a gentle chin tuck as they're going about these. The next thing to see is side bending range of motion. So I'll add a little bit of a tilt to the device. And Brian's going to be side bending to the right and then coming back to neutral. So go ahead. His form is excellent, so there's nothing to correct. Let's see the other side. Go ahead. With some patients, you will see them side bending and rotating in the same direction. And if that is the case, I'll just cue them with my hands. Very good. Next thing to see are strengthening exercises. So I'm going to add a resistance band to the platform. So now there's a resistance band on for all the strengthening exercises. We're also going to add a headband. So Brian, you're going to lift your head up and come on down. There are two surfaces to this headband, a soft side and a grippy side. The soft side will be on the inside on his hair and skin. We'll Velcro this across his forehead. And Brian, you can adjust that if you need. So now we'll start with rotator strengthening. So Brian, you're just going to be turning your head left and right. So we're doing that same range of motion rotation exercise, but now there's resistance applied to the platform, and we are strengthening all of the neck rotators. Brian's doing an excellent job of maintaining a gentle chin tuck, and he's staying right on plane. Next, I want to show you isometric holds. So Brian, you're going to lift your head up and slide the platform all the way to one side. Come on down. Now you're going to tuck your chin, and you're going to brace as you let go with your right hand. Now he's doing an isometric hold, and the platform wants to slide back to center. He's using his muscles to maintain a neutral position. I'll have them hold for 10 seconds, and they can reset and use the other side. Go ahead, Brian. Good. So here we can see Brian fell into a bit of a right side bend and right rotation. So we're just going to cue him out of that. And he'll hold again for 10 seconds. So come on out. Now we're going to move right into rotator eccentrics. So Brian, you're going to do that same setup position. So go ahead and slide the platform all the way to one side. Excellent. Let go. And now you're going to let the platform turn your head to the left. So the platform wants to recenter, and he allowed it to turn himself, and then he'll come back up to neutral. So here's the eccentric piece, and here's the concentric. Go ahead and tuck your chin a little bit. Go ahead. Very good. Come on back. Now let's do the other side real quick. Do a gentle chin tuck for me. Good. Very good. All right, let's recenter. Next, we're going to show you lateral flexor eccentrics. So the same setup position will be used. So you're going to slide the platform all the way to one side. Good. Now let go with your hand, and the platform wants to side bend him to the right. So we're going to allow that to happen. And then he's going to come and find neutral again. Go ahead. So a gentle chin tuck is maintained. And he's doing an excellent job of keeping his face up to the ceiling the entire time. Very good. Let's see the other side. So here we can see his head is rotating just slightly to the right as he side bends left. So we'll just cue him there, and he's off. Very good. Okay, you can come back to center. Next, we're going to move into the chin tuck setup positioning. So we have a yoga block here, but you can also incline the head of a treatment table. So I'm going to have Brian lie back for me, and his head is going to be at the bottom of the platform. We do not want the neck or the upper thoracic spine in contact with the device. So we can see here that he's a little bit too high up, so I'm going to have Brian scoot down about 3 inches. Very good. So the resistance band is currently in the platform, which prevents it from falling all the way down. I'm going to release that, and now the platform wants to slide down. The first exercise Brian's going to do is flexion and extension. So Brian, go ahead and tuck your chin and then look up towards me. Good. So this is a rudimentary exercise which will perfect chin tucks for your patient. So long as the platform is moving, the patient is doing a perfect chin tuck. I'll often have them hold for 3 seconds at the bottom. So now we can move into resisted chin tucks. So I'm going to add a resistance band to the platform, and we're also going to add the headband so that his head has grip on the platform. So Brian, go ahead and lift your head up and come on down. And I'm just going to Velcro this across his forehead, nice and snug. Do you need to adjust that? Okay, so now we're ready. Brian, you're going to lift your head up, and I'm going to preload this by sliding it towards me. Come on down. And now what that band wants to do is pull the platform so his head goes into extension. So now he has resisted chin tucks. So Brian, go ahead and do a 3-second hold at the bottom for me, and then release. So here are resisted chin tucks. The last thing to show you in this setup position is mechanical traction. So Brian, pause for me, and I'm going to exchange with the heaviest resistance band. Okay, so now that we have that in there, Brian, you're going to again lift your head up, and I'm going to slide the platform down towards him, which will preload it for a mechanical traction force. So come on down, and now I'm going to gently let go, and that is providing a mechanical traction. Those are the 3 things to show you in this chin tuck setup positioning. So now we're back in the base positioning, and now we're going to be doing manual therapy techniques with the Neckslevel device. The first thing to see is rhythmic stabilization. So Brian, I'm going to have you keep your head in neutral with a gentle chin tuck. And I'm going to be adding perturbations to his head, and he's going to keep his head still. There is no resistance band applied to the platform, so that makes this platform very free sliding, so it's difficult for him to stabilize. So he's in a bit of a chin tuck, and I'm going to start with lateral side bending perturbations. So I'm just waiting for Brian's muscles to kick on, and he's just meeting my resistance. If I feel everything tense up, I'll have Brian reset, take a deep breath, and then we'll begin again. We just want the muscles to kick on and then turn off with each perturbation. So that's lateral flexor. Now we have rotation. So Brian, I'm going to try to turn your head, and you're just going to keep it still. So we start predictable, and once he's mastered it, we'll go in a random order. So we have lateral flexors, rotators. We can play with speed, and we can also play with force applied to his head. So as he's comfortable, we'll start to speed it up. And I'm just waiting for those muscles to kick on, and I'm off to the next one. So that's rhythmic stabilization. The next thing to see is rotation manual resistance. So Brian, you're going to be turning your head left and right, so go ahead and start that. And then once I'm happy with his form, I'll come in and add resistance in either direction. Bimanual task, one hand on his temple, one hand on the back of the head. And notice that I'm switching with each rotation. Very good. So come on back to neutral. Now we're going to do manual resistance for the lateral flexors. So Brian, you're going to be moving into right and left side bend like this. and I'm going to add my hand for resistance. Good. All right, come back to center for me. The last thing to show you is passive range of motion. So if a patient is limited in rotation range of motion, I would start by doing passive range of motion as far as they feel comfortable. What's nice about doing it on the Neckslevel device is that their head can remain heavy on the platform, so they don't feel like they have to hold their neck up, which will cause all the muscles to kick on. From there, we can also move into side bending passive range of motion. So those are the big manual techniques that I'll commonly do with my patients. So I've shown you how to set up the device. We've worked through range of motion and strengthening exercises on the Neckslevel, and I've shown you my favorite manual therapy techniques. Now you have all the tools you need in the clinic to get your patients feeling better.